Hello, I'm Dr. Kim Burchell. I'm the chairman of neurological surgery here at Oregon Health and Science University. One of the major areas of interest of our department over the past 25 years has been the treatment of movement disorders. For most movement disorders, such as Parkinson's disease and essential tremor, medical management is by far the first choice and the first option. Unfortunately for many patients, medical therapy eventually fails, and the patient either fails to respond to the therapy or develops side effects from the therapy, and in those cases surgery might be considered. Now, over the past 50 years or so, most of these types of surgeries have been performed under local anesthesia with the patient awake on the operating table, sometimes for periods of 4 to 6 or more hours at a time. This obviously represented a major challenge to the patient and an area of discomfort for the patient. What we're trying to do currently is to use new technology to do this surgery under general anesthesia in a way that not only improves the patient experience, but also improves the safety and, we hope, the efficacy of this operation. What we hope to do in this short video is to show you the methodology we're currently using in hopes to provide a better experience and a safer experience for our patients.
Portable CT scanner, the CereTom, is used to determine the precise location for placement of the deep brain stimulation electrodes and to confirm the placement of these electrodes at the conclusion of the implantation surgery. A laser guidance system is used to accurately position the CT scanner during the surgery. A disposable stereotactic mini frame, the next frame, is used to guide the electrodes to target during the surgery. Two frames are placed simultaneously on the head, and both electrodes are introduced prior to the completion of surgery and CT scanning. The advantage of this approach is that planning can then take place at the time of surgery to both direct the electrode at the appropriate target and also create a trajectory that will avoid critical structures in the passage of the electrode to the target. Initially, the operating table is placed in such a fashion as to allow the anesthesiologist to induce general anesthesia. Once the patient is asleep, the bed is turned to face the CereTom scanner, and then the patient's head is placed within a device to stabilize it and allow safe surgery and accurate scanning. This head holder is placed under local anesthesia and placed in such a fashion that the scanner can then be used during the surgery to verify the trajectory and location of the electrodes. The entry points are marked on the scalp, and then the head is sterilely prepared. Special metal fiducial markers are placed on the scalp that can be visualized on the CT scanner. A scan is then performed, and based on this, the navigation coordinates can be established within the Medtronic stealth station and used for introduction of the electrodes using the next frame. At the conclusion of that scan, this CT scan is then merged into the previously obtained MRI scan, and the precise locations of the entry point burr holes are marked on the scalp. At this point, the head is sterilely prepared again, and the entry point incisions are marked on the right and left sides. The CT scanner itself is now sterilely dressed. The patient and the operating table are now covered by sterile drapes, and the surgery commences. The next frame is attached to the head, and then navigation using a sterile probe shows the direction to the target. The precise trajectory to the target is located on the video screen on the Medtronic stealth station. Once that is accomplished, the covering of the brain, the dura, is opened sharply. And then the deep brain stimulation electrode is advanced into the brain using a special stereotactic platform. Once the electrode is introduced, then the cannula that delivers the electrode into the brain is withdrawn, and gradually the stereotactic micrometer platform is removed from the head, leaving the electrode in place.
Okay. Are we in?
Once the electrode has been inserted, it is fixed to the head using a special clip, and then the process is repeated on the opposite side, such that both electrodes are now in place. At this point, the CereTom is brought back into position, and a second CT scan is performed to confirm the location of the electrodes. You can see here the patient in the scanner with both of the next frame bases attached to the head. Once this scan has been completed, it is imported into the Medtronic Stealth Station and then analyzed for the exact location of the implanted electrodes. Once the position of the electrodes has been confirmed on the CT scan, the wounds are closed and the wires are tunneled under the scalp in preparation for stage 2 of the procedures, where the generator will be implanted. These images show the scan at the end of the procedure, showing the placement of the electrodes on target, confirmed by both CT and MRI scanning. To learn more about this procedure, please visit our website at ohsu.edu/neurosurgery. Thank you.